So artificial intelligence and more in general new technologies can be applied in different fields of medicine, including subject carrying clonal hematopoiesis. And I think that with respect to this specific clinical scenario, artificial intelligence can help us to provide more reliable information at individual patient level about the risk of developing hematological cancer with a specific focus on myeloid malignancy. So in general terms, in the clinical scenario of clonal hematopoiesis, artificial intelligence can improve the capability to detect those patients at higher risk of developing AML and MDS, thus allowing an optimal patient management. Both MDS and AML refers to clinical scenarios characterized by a large biological heterogeneity. So this means that in terms of personalized medicine, we need for more precise methods that are able to integrate different information and maybe multi-omics data layer in order to define what is the optimal treatment strategy for each individual patient. And again, artificial intelligence has the capability to merge and integrate into an appropriate way a different kind of information and translating this information in the opportunity to improve clinical decision-making process for patients with myeloid malignancies.